To remain updated with the latest business news, click on the bell icon.
Well, we are just days away from the union budget now, and the healthcare sector could actually see some big ticket announcements on February 1st, 2022, in the budget speech by Finance Minister Nirmala Sitharaman. Well, if you see, India's total healthcare expenditure is considered significantly lower than that of the other countries, and that's been a tall ask every time. Despite the focus on the ongoing COVID 19 pandemic at the moment, it is critical that the government increases the proportion of spending on preventive healthcare and also overall wellness. The government could actually this time around look at announcing 10 to 12% rise in the healthcare expenditure, and the segment could actually see a higher allocation by almost 18,000 crore rupees in the overall package. Now, healthcare experts have also said that they expect the government to really look at increasing the healthcare expenditure above 2.5% of GDP and extend the National Health Protection Scheme to all migrant workers in addition to the BPL population that they are privy to right now. The pandemic has highlighted the critical need for high quality public hospitals to strengthen our primary healthcare system by also upgrading the infrastructure and also strengthen the pediatric care, along with setting up of some training programs for all the healthcare experts. Now, the need for of the hour, they say, is to improve healthcare funding with subsidized loans, incentivizing CSR initiatives by making it a tax deductible expense and allocating land for new hospitals too. The care of elderly is also a critical area. The issue of financial protection of the senior citizens is a very important factor which many healthcare experts have urged the government to look at this time around. Medical experts have also made an appeal to the government asking to invest more into genetic and genome research given the repeated occurrences of infectious diseases. Deloitte India has recommended tax holidays for rural hospitals with flexibility to select beneficial years and viability gap funding by the government for setting up of hospitals in tier 1 and also tier 2 cities. Now, the firm has also recommended a weighted deduction of expenses that are incurred on skill development due to the shortage of manpower in the healthcare sector. Whereas CII has also urged the government to create a medical innovation fund to support companies with the capital to promote digital healthcare infrastructure. CII has also urged the government to provide job stamps to benefit workers in the health centers. These job stamps, they say, can be used to pay workers hired at the minimum wage through government certified placement agencies that register the unemployed and later monitor the work as well. Now, overall speaking, there's a long list of expectations and wish list this time around, but how much of it will actually make it to the final budget is something that we'll have to wait to really find out. Of course, apart from this, a whole host of other demands are always on reduction of GST on medical devices, although GST is now out of the purview of the budget, so that will be taken up separately, but that's again a tall ask by the healthcare sector as well. We'll have to really wait to find out what really makes it to the final budget speech on 1st of February as far as the healthcare sector is concerned. But we leave you at that. But if budget is on your mind, do stay tuned on to Business Today. Like this video if you like it, and also subscribe to our YouTube channel and stick with us via our social media platforms. That's Twitter, LinkedIn, Facebook, and Instagram. Thank you for tuning in.
If you like the video, do like, comment, share, and subscribe.